Hello, everyone, and welcome to the Wellness Junction podcast. The Wellness Junction podcast is a podcast that integrates mental health and sexual reproductive health. Today, we are bringing you a very rich conversation about mental health. Today, I have a very beautiful guest here with me who has traveled all the way from Canada. My name is Elizabeth Oram, and I'm your host today. How are you?
I'm well. How are you?
I'm fine.
Thanks for having me.
Thanks for coming. So, Marwa, I don't know if I can spell your name well. Is that the right name?
That's correct. That's my last name.
Okay, so can you introduce yourself? Just a brief description of yourself.
Yeah, I'm Marwa. I'm a final year global health student at York University. I'm specializing in health promotion and disease prevention, and I really enjoy research.
Yeah. Thank you so much. So you travel all the way from Canada, from York University. So what was the drive? How did you decide now to choose this community?
Yeah, I guess as part of being a final year student in the global health program, you have to do a placement at the end. And Pamoja was presented to me as one of York's partners. So I did my research. I've always wanted to visit Kenya. So I said, that's amazing. And then what really drew me to pick this place was that the project was focused on mental health, and that's something I really advocate for in my personal life.
So far, how do you find Kenya?
Oh, I love Kenya. I'll be so sad when I leave. I like, in Toronto it's very cold. There's no sense of community like there is in Kenya. The people are nice. The food tastes more fresh. There's so many things I'll miss.
Thank you so much for sharing that. So for someone who is listening to you right now, can you tell us maybe a background of your research on that mental health? What were you doing in the field?
Yeah, so this is Pamoja's project. It's called the Maya Project. It's mental health for adolescents and young adults. So in the field, you were with me. Yes, you were with me. We did the qualitative portion of the study. So we went out in the field. We did some focus groups with various target groups from young mothers, GBV survivors, young men, caregivers as well, to hear their perspectives, and school-going people. And then we also did some in-depth interviews. So after all of that, we were able to get some insights to what's really going on in Kisumu when it comes to young people's mental health.
So what was the most significant part that you found? Maybe initially when you were coming, you had some perception, then when you reached on the ground, is there anything that changed?
I think one of the biggest reasons I chose to come to Kenya was because there's very limited partners that we have in Africa, and I feel that what we're learning in the global north isn't accurate to what's going on in the community. I feel there's a lot of negative perceptions about how care is done here, and I really wanted to hear the lived experiences of people. That's really why I wanted to do this.
Okay, thank you so much. So, is there anything that you've learned new about mental health that you didn't know about?
I guess the most important thing to me that I learned about mental health among young people is this concept of peer mentors. We don't have that in Toronto. I guess if someone's experiencing a mental health disorder, it's a very clinical event, meaning they go to a counselor, and then after they do therapy and all of that, then we send them to community programs. But what I really appreciate here, and what's significant to me, is that it's done in a way where it's accessible. So the people will speak to their peer mentor first, and then we move up into a clinical event. And I think that's something that's very important, and we should really value things like that.
Yeah. So according to you, interacting with the youth, was there any challenges that they have faced in the process of seeking mental health care? Or are there maybe barriers that are preventing them from seeking such help?
Yeah, I would start by saying that from our experience, well, more so my perception, what I'm seeing from the youth is that when it comes to like a biomedical view of what mental health is, when we ask them, part of the interview questions was to ask them what do they think mental health is. A lot of them really did not know. They used idioms or cultural ways of expression to express what mental health meant. But part of that was that they also recognized that mental health is important. I guess through our focus groups and our interviews, we haven't had anyone say that no, mental health is not important. So I think that's something that was very significant. A barrier that a lot of youth were discussing was a lot of social determinants of health. So, and structural ones. For example, a lot of youth said that when it's time to go and seek support, maybe they need more clinical support, they want to speak to a counselor, it's not accessible. They need transportation. Sometimes it rains, the roads are not paved for them to walk, and that's a very real and strong barrier. And then obviously the referral pathway that we produced as an output, we hope that that can be accessible to the youth so that they know if they have any, if they ever experience any mental health challenges, then this is the way that they can integrate into the mental health care system.
So according to you, or according to the way you interacted with the youth, are there some structures that are there for them that they can really seek help immediately?
At this stage, given we haven't implemented our recommendations yet, at this stage the biggest structure and source of support for them, especially young adults, is their peer mentors. A lot of them, when they experience a mental health struggle, they go to their peer mentor before even going to the community health promoter. I think that's a very important thing. But that also brings up our recommendation of these peer mentors. They deserve to be trained and have the resources to protect themselves and the people, the young people that they interact with.
And do they have support maybe from their guardians or parents?
I would say, I'm speaking from the top of my head, but I would say more so among school-going young people, though they heavily rely on their guardians. A lot of people also really value the relationships they have with their siblings, and I thought that was really special. We've had a lot of people say that, you know, if I have a problem, I'll tell my sister or my brother, and they're their source of trust, a trusted person I can speak to.
So if you are talking directly to the parents, what would you tell them in relation to the support they can give to their people?
I think first, because I'm not a parent, I don't really know. I would tell them that first, being a parent is a hard job. I can't imagine what it's like to be a parent in Kisumu or the rural communities. I would say the only advice I really have at this stage would just be to be a listening ear. Sometimes the best thing you can do is just listen. You don't have to really reply or give advice. When people are experiencing mental health challenges, you just have to listen, and then at the first time you listen, the next time maybe they'll want advice. So that's really the advice I would give,
Thank you so much. What if you are talking directly to the healthcare providers?
If I was talking directly to the healthcare provider, the first thing I would say is their job is a hard job. And that you need to protect your own mental health if you want to be a good healthcare professional. I would tell them that maybe we need to look into more innovative ways of getting youth-friendly supports of psychosocial support groups. And there's a lot of different things they can do, but we can talk a little bit about that maybe later on.
So maybe the relevant authorities, what should you tell them?
I guess when it comes to mental health, especially in Kenya, it is a major cause of disability among young people, and that's been quantified. And another thing is that mental health is a major global health burden, especially among young people in the African continent. a lot of people are losing their lives for mental health. In my perspective, mental health should be taken just as seriously as physical health. We need policy, especially from the government level, and funding that would improve the structures and the referral pathway. We need to have more counselors be accessible in the community, do more community outreach. It's very difficult because a lot of psychiatrists are in town, and for a lot of people to get to town, that takes money and transport. So that's a barrier. So it'd be nice to start by doing some outreach, start by investing more in the structures, especially here in Kisumu. Yeah.
So do you think that if all these are present, like if all these systems are there, the young people will be able to seek help?
I think, yeah. I do think so. I think from our field discussions, a lot of people say that the real barrier is that they don't know where to go. I think with all of that, if you add in mental health education and we really formalize the referral pathway, then yeah, it would be easier for them to at least know where to seek help. And then obviously capacity building, the peer mentors and village elders, for example, just to know if a young person comes to them, or even an adult, anyone comes to them about mental health, hey, this is where you would refer them. This is when you'd know it's a serious case. I think if those were present, it'd be at least a bit easier for people. But again, there's also the barrier of stigma in the community. And that stops a lot of people from going. A lot of young people share that a big reason why they don't seek help or care is because people will talk about them. So I think that also couples up with mental health education, and hopefully that can help at least a little bit with mental health.
Yeah, thank you so much. And so according to how you've interacted with other young people, you've interacted with the healthcare providers. So if right now there's that young person who is really struggling mentally, is there some advice you can offer?
Yeah, I guess I'm not a medical or healthcare professional, but from a friend perspective, the first things I would say is that you are not alone. All of us at some point, almost every single person, we go through mental health, whether that be anxiety, depression. Some of us, we still live with mental health, but it does get better. It's not a stagnant state. Just like physical health, once you learn just simple coping strategies like, okay, I'm having a really stressful life event, let me speak to someone I can trust, like example, my peer mentor. And then after that, just simple things that bring you joy. Like me personally, I really like to do yoga. So I would tell them to maybe do something that makes them happy, and mindfulness is very important. But I would also urge them that if they feel like their problems are too much and that they really have nobody to go to, please seek help. It's not a shame to want to be better. We all go through this, whether in Kenya, in Kisumu, in Canada, all over the world. All as young people, we deal with things like this. So yeah, seek help. I know that right now it's not very easy for them, but just to speak to your peer mentor, maybe approach your community organizations like Pamoja. Pamoja is an amazing place. The team is very equipped to help people. There's a lot of different ways you can get help. So I would just really urge them, you can do it.
Oh, thank you so much. So you've talked about one of your coping mechanisms is maybe do yoga. So while interacting with young people, were there some of the coping mechanisms that they use, or maybe others that you can share so that other young people can also adapt?
That's a really good point to bring up. I'd say on the positive end, a lot of young people said that they like to watch movies, documentaries, they like to sing, they like to listen to music. That helps them go through difficult times. A lot of them also share, especially among the young boys, they do share that they like to play sports. That makes them feel less stressed. But also on a little bit of the less positive side, a lot of young people which I thought was very interesting, use hope as a coping mechanism. So instead of realizing or addressing the issues they're facing, they just say that, oh, it'll get better, I just have to deal with this. But some of them, they've been having that mentality for years and years, and it's not getting better. So that's a coping mechanism that I feel can turn negative if they're not realizing that it's a problem. Another one that's unfortunate is that a lot of young people are turning to drugs and substance abuse when they're going through stressful times. But that's a trend that's really going on all over the world, really. I think that's what I can think of off the top of my head.
Okay, thank you so much. So if there is a there that is undergoing mental health challenges, kindly just believe in yourself and know that you are not alone, and there are several coping mechanisms that you can adopt. So maybe if you are interested in sports, you can engage yourself in sport. If you are interested in reading, you can try reading. If you are somebody who likes to jot down your thoughts, maybe you can try writing. And there are so many amazing things that you can do, and so many creative things that you can do to be able to cope positively to the challenges that you face. So thank you so much, Marwa, for sharing that. Another thing, how has this research changed your life, or has it changed your life in the first place? And maybe how would you want to engage further with things around mental health?
Yeah, I think, oh my, this is a really nice question. I would say my travel to Kenya as a whole has changed my life. I think I'm very privileged to have had this experience. I'm also a part of the Queen Elizabeth Scholarship Program. So having that prestigious scholarship, being able to do meaningful community work is something I won't forget. I take to heart the privilege that I've had. I'd say Pamoja as a whole has changed my life. I've seen the commitment to the community, the last minute change of plans, adapting, doing community dissemination. Something I really appreciated and I personally value, for one, is that as part of our team discussion, we said that it's not fair that I came from Canada to do this research and I'm not sharing what I learned with the community. So that's when we planned the Community Dissemination Day. And we owe that to the community, especially me as a foreigner. I came, I took their experiences, we'll write it up. They deserve to know what's going on. And all the information is very accessible to them at any point that they would like to. But yeah, I think having the experience to take on a leading role in qualitative research, especially in your undergrad, is a huge privilege also. And that has really changed my life. I feel that it's prepared me quite well for graduate school and hopefully a career in global health.
Thank you so much. That's really nice. Actually, you can clap for yourself for that. Very interesting and very insightful, because when going to the field, you really interacted with people and you got to learn a lot, as we've also been able to learn a lot from you. So it's been an exchange, it's been a mutual exchange, because through interacting, there are some things that we didn't know, then we got to learn from you. And also there are some things that you didn't know that you got to learn from us, especially working in the rural community. So thank you so much for choosing us as Pamoja community-based organization. And also thank you for your university for trusting us with taking care of you. Because while you are here, we are honored. So thanks to the York University for trusting Pamoja to take care of your beautiful young. So for any young people out there who are still navigating their career and maybe their education, is there any advice that you can offer?
Yes, I would love to give this advice. The first piece I would give is that Kenya is a beautiful country.
Thank you.
There is a lot of very, very, very bright young people. One of them right here. I think that the future, based on the young people I've interacted with, is very bright here in Kenya. I think that education, as me as a person, I really value education. I, for one, the reason why I value education is because my mom, she never got the opportunity to get any kind of formal education, and that's been instilled in me very deep. And I've seen the privilege I've had to go to school and do all of this. But I also know that school fees is a big barrier here in Kenya. So I hope that in the near future we can work on finding a common ground to address that. But yeah, career path-wise, for me, myself, this is very generic advice. I just follow my passion. Where the wind blows me, I go. It's very important as a young person to take all the experiences you can get, any experience. I've even worked as a basketball coach. I don't even know how to play basketball. I don't know how to play basketball, but that's opened doors for me. Like, you have to just take what you get and you will move forward. And also, it's very important that you enjoy the work you do. As a young person, we are privileged. We get to change jobs if we don't like it. And we have to take advantage of that until we find one that we really, really enjoy. And for me, for once, I personally really enjoy research and policy. I'm happy that through my many years of work experience, I've been able to find my passion.
Thank you so much. So young people out there, you've heard what Marwa has said, that young people, you have to explore in the first place. Then you have to experience a lot of things to be able to find your passion. So once you find your passion, then you are able to build on it, to build on your passion. Then always look for opportunities that align with your passion. And also, every opportunity that you get, you should be able to take it. Always take that opportunity, grab that opportunity whenever you get that opportunity. So thank you so much for that, Marwa. So is there anything else you'd like to tell us or you'd like to add on that conversation?
I would just say, again, a big, big thank you to you.
Me.
Yes. Elizabeth, you're with me in the field every day, and that's a privilege to me as well. I'd say thank you very much to Pamoja. You changed my life. Also, a big thank you to all of the participants, really, and their vulnerability to share with us, the peer mentors, all of the staff at Pamoja, my supervisors, Judith, as well as Patrick, and I can't forget to mention Philip, who was also with us in the field every day. And also, again, my university and the Queen Elizabeth Scholarship Program. I've just had a very nice time. I've been able to do some really nice work with Pamoja, so I'm just very grateful, and I'm happy that we've been able to find some time to sit down together and share this with others.
Oh, thank you so much. And also, it's been a privilege working alongside you, and I think I've been able to learn a lot in terms of research, by the way. And it was a privilege, and I also thank Pamoja for giving me the opportunity. I know there are so many staff who have been given this opportunity, but then they chose me to work alongside you, so I don't take that for granted. And for young people, this conversation will go to young people out there. So mental health, I know, is a very critical issue that is affecting a lot of people. And even if we leave young people out, so many people are undergoing mental health challenges. So maybe some people who are still navigating schools, other young people, you find that young mothers who are still navigating career development at the same time, navigating motherhood. I know those are some of the things that comes with a lot of mental health challenges. And other people who might be undergoing maybe family pressures, and we have a lot of pressures. And also our country, now that we come from African countries that are still developing, and we have a lot of challenges, maybe economically and everything, you find that people navigate a lot in life. So those all life transitions that result to our mental health challenges and the pressure that comes with it, we just have to find ways on how to navigate, and always try to talk to someone in case you are going through a lot and in case we are facing so much pressure. So mental health is a conversation that we can't go without talking about, and kindly, for those of us who might be going through mental health, don't hesitate to seek help. And for everyone, for every individual, kindly, let's just try to support each other, because it's not good to stigmatize someone, because today it's me, the next day it will be you. So you might not know how you'll be affected, but by supporting each other, then we'll be able to grow as a family or as a community in large, and that way we'll be able to develop our country. So thank you so much.